Cody, I want to start with, can you walk us through and tell us about the time you got diagnosed for the first time back in 2020? What was that experience like in the sort of current state of sexual wellness and treatment in Oklahoma City? What was that process like for you?
Well, I didn't know anything about it. It came as a shock. So it was February the 13th, 2020. And the doctor walked in, told me, took his piece of paper from the health department that he had printed off, kind of threw it down and said, call the health department. And I was shocked. I was nervous. I was scared. I was everything wrapped up all into one. And I'm usually a pretty calm, collected guy, but at that point, you tend to lose it. And had a bedside manner of a rock. I mean, he was terrible. And so from that point, I called the health department and started trying to navigate this system that is not set up to be patient friendly. And so, as if there aren't enough roadblocks, say I was someone who didn't have health insurance, even decent health insurance, I wouldn't have been able to get help immediately, period. And so whenever they told me, we're going to get you into this one particular clinic, they said, it'll probably be about 6 months until you get in there. So imagine somebody saying, okay, you've just been diagnosed with a life-altering virus. It'll be 6 months before we get you into the doctor. So before I could even breathe, take a breath, I just went into this mental state to move forward with the clinic, move forward with a way to help people.
So we'll get into that on how you started. Something caught my attention that you said I wanted to get your thoughts on is, you said that this was something you did to yourself. Can you elaborate on what did you mean by that? And when you think about the plight of other patients that are diagnosed to be HIV positive, it's a life-altering decision. Yeah, what did you mean by that? And how are other patients kind of dealing with something similar? And why did you even decide to get tested to begin with?
Yeah. I mean that by not being careful enough, using protection. In my particular circumstance, I was in a monogamous relationship that I thought, but come to find out I wasn't, and that was my mistake, And so that's what I mean by I did it to myself. But what made me get tested was I started to get sick. I had got more sick than I had ever been in my life. I thought I was going to die. I was so sick. And then came out of that, I lost like 20 pounds. And I was like, I really need to get this figured out. I need to know what's going on here.
And this was for a prolonged period of time, for several months, or?
No, I thought I had the flu.
It was just like a flu. Okay.
Yeah, just like a flu. And then I got better. And honestly, I think like anybody else in the world, you lose 20 pounds, you think, oh man, that's great. But it didn't stop. It kept going. My mom was like, hey, you're losing weight. What's going on? Are you eating enough? Are you stressed enough? But, we carry so much stress in our lives that we blame it on that.
Got it. And you talked about the sort of the bedside manner, the way you were treated when you were diagnosed. Can you tell us more about kind of what that was like? And it sounds like we'll get into kind of that when you set up Equality Health Group, kind of changing the status quo of how maybe you felt marginalized or diminished or ashamed at the time it happened. Can you tell us more about what did that feel like going through the normal healthcare system? This is here in America.
Yep.
And what that process was like for you. Mind you, just the fear of waiting for 6 months to see a doctor, the way you were told, it sounds like there's some stuff behind that as well.
Yeah, it was terrible. So it was actually the nurse that gave me a little bit of comfort. It did not come from the doctor. It was just very standoffish. It was very cold. It wasn't inviting. It was just, I left there knowing that I was going to have to find my own way, not with the path. There was nobody there to, pat me on the back and say it's going to be okay. There was nobody saying, listen, you're just going to take a pill a day for the rest of your life. You're going to be undetectable and everything's going to be fine. There was no one there to do that. And so that's the void that we needed filled.
Why do you think that doesn't exist in our country today, with the state of the treatments that can treat HIV to keep your viral load really low? the disease state is still stigmatized to a level that,
Yeah.
how do you explain that today in our current healthcare system?
I think it's more of just the remnants of what happened in the 80s and 90s and generationally, what happened through there, and then the lack of education. Whenever we explain U equals U, undetectable equals untransmittable, people are taken aback. And it's 2023, but then I have to remember that just in 2020, I was the same way. Whenever I was diagnosed, I had my own stigma because I thought I was going to die. Because when you get diagnosed with HIV, it's not just you're worried about. You're worried about the people you slept with. You're worried about your friends, what they're going to think if they find out. You're worried about your mom, your dad, everybody. You're worried about everyone because you don't want anybody to stop loving you because you have a disease that's so stigmatized. Being stigmatized is something, even in 2023, that can have a detrimental effect on everyone. And it does on, physicians, physician staff, patients, everyone. And it just kind of bleeds out into the community. So you have this wall that you put up. You may be gay. Then you have HIV. Then you have all the complications that come with that. Or what if you're undocumented and you're Hispanic and you have no social, and then you don't know how to get the health care, and then there's no insurance company that will take you because you don't have a social. Oh, and then you don't speak English.
Yeah.
And you have HIV.
Yeah.
You know how many barriers that is? So we make it easy.
Yeah.
That's why we do what we do.